We've seen death. We've seen disability. We've seen disfigurement. We've seen deprivation. We've seen destitution from snakebite.
At the moment, as a minister for this county, I am extremely worried. I'm scared. I don't know what will happen.
Es una realidad diaria, una carrera para cruzar tierras remotas, rocosas y hostiles, sabiendo que el tratamiento podría llegar en horas o días.
Can you imagine the distress of running from your home, perhaps in the night, with a child on your back, suffering from snake bites, screaming in pain?
Y cuando logra detener un vehículo que pasa con la esperanza de llegar al hospital, ¿tendrá el hospital el suero antiveneno para salvarle la vida a su hija?
This is the only one left? You mean this is the only one left in the whole hospital?
Antivenom is very scarce. It comes and then it gets finished, then we stay without it for some time.
Es una tristeza diaria que nunca desaparece. Su hija sepultada junto a su hogar. Otra vida arrebatada durante la noche. Y la hermana que sobrevivió corrió la misma suerte que ella cuando la misma cobra se introdujo en su cama. Ahora tiene la mano muy deformada, está ciega, no puede caminar y nunca se casará. Una víctima inocente sin opción a una vida productiva. Es una devastación diaria que no tiene fin. Un agricultor de coco en el sur de la India que solo puede ver a otro trepar los árboles que él alguna vez trepó. Solo le quedan años de deudas. Selvarazu y su esposa parten con lo poco que tienen para pagarle la escuela a sus hijos.
Most victims of snakebite are amongst the most impoverished levels of the community. They're nearly all agricultural workers, farmers, herdsmen, who live in a snake-infested environment. And the city dwellers may be genuinely ignorant of the plight of people who live perhaps only a few miles away and who are the food producers for the country.
It's a huge cost that you cannot imagine. But then they have to sell and dispose of all the assets that are in the family to ensure that this person is taken care of.
Okay, so the people raising their hands have been bitten by snake.
Alrededor del mundo, como en esta reunión de la comunidad en el centro de Kenia, los indefensos claman ayuda. Pero estos son los llantos reales. Esa niña keniana de 3 años no saldrá a jugar hoy. En cambio, realizará como cada semana una de sus tantas visitas para tratar su herida. En unos meses, se someterá a un importante injerto de piel.
Many major health challenges of the past are now being dealt with subsidised treatments. The world has the capacity to deal with these problems. We've got neglected tropical diseases that are no longer being neglected, and that's important. But today, 342 snakebite victims across the tropics are going to be taken from their families. We know 125,000 people die each year from snakebite. And 2 to 3 times that number are left without limbs, they're maimed, disabled, or permanently disfigured. And those are the people who actually make it to a hospital to be counted. Whatever the numbers may be, the true figures go beyond any data, beyond any study. The only way you can truly understand snakebite is to walk into any hospital or any village. Everybody knows somebody who's had their lives turned upside down. Snakebite is something that they fear more than malaria or tuberculosis, or in some cases, even more than HIV/AIDS.
De Vietnam a Pakistán, de la República Centroafricana a Latinoamérica. Si pinta en un mapa mundial los lugares donde las muertes reportadas superan 1,000 personas al año, es un mapa que rápidamente se vuelve más colorido. Y si agrega los países con 50 o más muertes al año, de golpe, la magnitud se vuelve clara.
If we are to save lives, our limbs, this is the time for the whole world to wake up to this important problem that has for many years lingered with no interest.
Realistically, the best long-term strategy is to prevent snake bites, not have to treat them in the first place. We have scientists, doctors, advocates all around the world who fight for these people on a daily basis. Educating people on the ground to encourage the simple use of footwear, training rural health workers, and even teaching people that visiting a traditional healer is not necessarily of any use. And of course, we have effective and affordable antivenoms that have been developed and are making huge differences in places like West Africa, Latin America, even here in Papua New Guinea. We have the tools to make change now.
It is about time that snakebite is stopped being ignored by the world. It's a matter of human rights, it's a matter of social responsibility, it's a matter of using science for what it should be used, for the well-being of people.
Nobody should die of snakebite.